I'm Nelli Bejanyan. I'm the program leader of BMT at Moffitt Cancer Center, and on behalf of my colleagues at BMT department as well as at the Heme Malignancy department, I'm presenting this phase 1 study with use of ex vivo expanded donor-derived gamma delta T cells to infuse patients to prevent relapse after allogeneic stem cell transplantation who have high-risk acute myeloid leukemia. Relapse is the leading cause of mortality after allogeneic transplantation, and we try to prevent it in this study, where high-risk patients had either cytogenetic or molecular adverse features. More than 50% of the patients also had measurable residual disease prior to allogeneic transplantation, and all patients received reduced intensity conditioning transplant with expected relapse risk of about 50 to 65% with in this extra high risk cohort of patients. So the trial followed 3+3 design, where we infuse patients gamma delta T cells between day 60 to 100 after allogeneic transplantation. At dose level 3, we infuse patients 100 million cells per kilogram. And the primary endpoint of this study was the maximal tolerated dose. This was very safe intervention with no dose-limited toxicities observed in any of the patients studied. None of the patients experienced acute graft versus host disease, cytokine release syndrome, or neurotoxicity in this study. In addition, we looked into safety profile, and here we are presenting first 9 patients only in this study because we wanted to have at least 6-month follow-up in these patients to be able to show the efficacy of this intervention. And as you can appreciate here, we only had 1 patient who relapsed 8 months after allogeneic transplantation following the infusion of gamma delta T cells. The rest of the 8 patients, despite having these high-risk mutational or cytogenetic abnormalities, remain in remission at 6 months, as well as at 1 year following gamma delta T cell infusion. And all these 8 patients were MRD negative, as well as had 100% donor chimerism at last evaluation 1 year after infusion. So these results are quite promising, both from safety as well as efficacy standpoint. And we are looking to conduct the subsequent study, phase 2, with recommended dose of 100 million cells per kilogram. So therefore, we believe that there is a role of gamma delta T cell immunotherapy in patients with high-risk AML, and hopefully we can cure some more patients with this aggressive disease.